8:14, Tommy Tucker, WWL, 80% chance for showers today. Doc, I think Dr. Brent Wallis, Chief Medical Officer of People's Health, I think I'm beginning to mildew.
I think I saw the sun this morning. I wasn't quite sure, but I'm sure it won't be out for long.
Man, I'm telling you, we're approaching the one-year mark of Hurricane Ida, of course, the anniversary of Katrina as well, most active time for hurricane season in Louisiana. If you have not yet begun preparing your hurricane kit, now's the time. Dr. B is going to tell us how older adults, I guess, should conduct themselves, some tips for older adults with hurricane preparedness. Right, Doc?
Yeah, definitely. It's not something we like to talk about, but unfortunately, this time of year, we've got to start having a discussion about it.
I always think that you should look at it as a negative gree-gree, and I know that's not a scientific scientific thing, but if you do it, then maybe you'll never have to, right? That's
true. Make sure you're prepared, and hopefully you never need to use it.
So how do you start about creating a hurricane kit?
Yeah, there's a lot of resources online that you can use. We've got a good one, peopleshealth.com/hurricane. It has a good little PDF you can download that's got information. In general, what I tell people, you need the basics. You've got to have a little bit of cash and your credit cards. If it's a storm where you're going to shelter in place, make sure you've got a flashlight, radio, plenty of batteries. We know we're going to lose power, and it could be out for quite a long time. But, the things around your medical care are really critical. So you want to keep a couple of things in mind. In particular, make sure you've got a valid ID, so your driver's license, so that if you need to go somewhere, you can identify who you are. Make sure that you have your health plan identification card as well. So if something happens and you're going to a doctor or a facility maybe out of the area where you live, you want to make sure you have that so there's no issues with getting the treatment that you need. And then the other thing would be any medical supplies that you need for your chronic conditions. Primarily that means your prescription medications. And I always tell people, a lot of people use pill boxes, but it's really important to make sure if you do have to travel somewhere or evacuate, bring the original containers along with you, or ask your doctor for a printout of your medications, because if you show up somewhere else with a box full of white and peach-colored pills, they're not going to be able to tell what you're taking.
And, of course, as Dr. B said, you can go to peopleshealth.com/hurricane, and it'll help you get your kit together, a good tip sheet there. But you mentioned prescriptions, and that is especially important that you need to take care of, right?
Yeah, definitely. When something is going on, in the Gulf, people get very stressed out, and sometimes you forget to take care of yourself or take your medicines, and it's more important than ever to make sure you're taking those medicines as prescribed. You need to make sure you have at least a 2-week supply of your medicines at all times, really, but especially during this time of year. If you do need to leave your home suddenly, then you've got to make sure you have those. And keep in mind that, if you're on, routine refills, you may think it's too soon to get a refill on your medication, but whenever we have a storm or some sort of emergency event, that refill too soon is waived, and so you can actually call the pharmacy and get another supply of your medication so you've got them when you need them.
I would think this becomes especially important if you got some kind of chronic condition.
Yeah, definitely. And, people that have chronic medical problems need to be real sure that, that they know what they're going to do. If you do think you're going to have to leave, you need to know where you're going. And if you get somewhere and you do have a medical problem, where are you going to access care? So, kind of taking a little inventory of where the emergency rooms are and urgent care is, that's really important. For our diabetics in particular, it can be very important. Some of them are on insulin. They need to continue checking their blood sugars, and they've really got to make sure that they eat, because if you are taking your medicines as prescribed but you're forgetting to eat, then that could make your sugar drop low. And then, another group that we worry a lot about is our patients with chronic kidney disease. Some of those patients are on dialysis, and they go to dialysis multiple times per week, usually somewhere near their home, Well, if suddenly you're not near your home and, you've had to evacuate out of the area or even out of state, you've got to make sure that you know where you're going to go. So, always ask your doctor what they really need you to know. If you end up somewhere else, they can usually give you a packet of information, with all your medical diagnoses and all of the medicines that you're taking. So if you need it, you've got it available.
During a natural disaster, for people that do have a chronic condition, I can't imagine stress helps anything.
Yeah, no, definitely not. In fact, stress increases the amount of stress hormones that you've got in your body, and those hormones can do a lot of things. In particular, though, they can raise your blood sugar. So if you've got diabetes and you're real stressed out, your blood sugar is going to be higher. So that may mean that you need to adjust your diet, take additional insulin if you are on insulin. Really check your blood sugars frequently. The other thing that stress hormones really trigger is high blood pressure. So if you're taking medicine for your pressure and you're stressed out, your pressure is probably going to be a little bit higher. So you want to kind of figure out how you can feel a little bit emotionally better. Don't get so stressed out, but most important, make sure you're taking your medicines as directed.
And I would guess all about preparation. You got a plan, even if you get stuck in traffic for hours in the car. We're talking about hurricane season and preparedness for maybe elderly people or people that have chronic medical conditions with Dr. Brent Wallis from People's Health. We'll continue when we come back. It's 8:20. That's time for traffic now on WWL. Coming up on 8:26 now, Tommy Tucker, Thursday morning, August 25th. The tropics relatively quiet, and I think every day we put behind us in August is an accomplishment, but it only takes one storm, as we all know. And Dr. Brent Wallis, Chief Medical Officer of People's Health, is here to help kind of explain what you should have in a hurricane kit and get yourself ready. You want to prepare. You never want to have to use it, but just in case, the time when a storm is threatening is not the time to start to get ready. Doc, what are some other tips you got for folks, that things they should consider?
Yeah, sure. Like you said, Tommy, preparation is key. And, so a couple of other things to think about. If it's either you that may have to suddenly evacuate or maybe you're actually assisting someone else, an older adult or a parent. You may have a situation where someone has trouble speaking or trouble hearing. Maybe they wear a hearing aid. So, I usually recommend that they bring along with them a pad and pencil. You don't want to be caught in a situation where you can't communicate very easily. And then a lot of our older patients actually have mobility challenges. They may use walkers, they may use wheelchairs. So keep in mind, if you do have to leave your home area, you're going to be in a foreign situation where you don't know exactly what you're getting into. You certainly don't want to get into a situation where you trip and fall and actually injure yourself. So, kind of think about how you would need to handle that as well. With wheelchairs in particular, they can be pretty big. And so that really can dictate how you evacuate or how you get out of town and also where you can go. Not everywhere is 100% wheelchair accessible, so kind of keep that in mind. And then, the other one that I think about a lot is pets. Mm-hmm. You may have a pet or a service dog. You want to make sure that you've got food for them, certainly, but the other thing to keep in mind this time of year is make sure their vaccines are up to date, because if you have to board them somewhere, they won't take them without those vaccines. And then not all hotels will allow pets to come. I know we're always in that situation with our Boxer Jack. They're not always willing to take in larger dogs, too. So think about where you're going to go and make sure that they accept everybody in your family.
Some emergency resources, Doc, you would recommend people add to their kit?
Yeah, there's, unfortunately, we're really getting pretty good at this, so we've got a lot of local resources you can use. The easiest one is just call 211 from your phone. You're going to get connected with somebody that can tell you about, support in the area. You want to make sure you're checking on weather. You can do that online or on any of our stations. WWL is great about keeping us informed what's going on. A couple of great websites to keep in mind: emergency.louisiana.gov actually has a lot of information on evacuation and also recovery efforts after the storm. And then ready.nola.gov has a lot of resources for people that live right in the city. More accidents happen after a storm than actually during a storm, so that's why it's really critical to be thinking about these things in advance.
Doc, I would think if you're elderly or have a chronic medical condition, factoring into your decision of whether to go or stay, you got to figure on how hot it's going to be after, right, with no power?
Yeah, definitely. And we know, we've been through it enough. It can get extremely warm after the storm when the sun comes back out. And if you don't have energy for a couple of weeks, that's going to be a problem. So if you've got chronic problems and you're on medications in particular, you probably need to be thinking about getting out of town if at all possible.
Thank you, Doc. A pleasure as always. Very informative. Dr. Brent Wallis, Chief Medical Officer at People's Health. Have a good weekend.
Thanks, Tommy. You too.
Pet Jack for me, would you please?
Will do.
I miss my Betsy. All right, you can go to peopleshealth.com to find out more about People's Health. You can visit the People's Health United Healthcare Medicare Center at 3017 Vets. That's in Metairie, right next to Party City. Appointments are recommended, but walk-ins are welcome. You can call 1-800-978-9765. And, of course, you can also always follow the 5-Star People's Health on Facebook, Twitter, and Instagram. We'll talk to Councilman Joe Giarrusso about Mayor Cantrell when we come back. Right now it's time for WWL First News. For that, we go to Ian Ozan.